All right. Good morning. My name is Ryan Soheim. I am presenting this paper, Risk Factors and Natural History of Bedside PEG Tubes versus Fluoroscopic Guided Gastrostomy Tubes in ICU patients. No disclosures. So in ICUs, trach and PEGs are often an afterthought of patient's care in terms of the risks and benefits are not sometimes fully appreciated. And this presentation is mostly inspired after multiple M&Ms where one of myself is, at the M&M podium presenting a PEG tube gone wrong. And it made me wonder, what are we doing and why did we get this kind of outcome? And there's really a paucity of data looking at outcomes of PEG tubes and other gastrostomy tubes in ICU patients. So the purpose of this paper was to look at and better elucidate the natural history of PEG tubes in ICU patients and also comparing it to fluoroscopic gastrostomy tube placement by interventional radiologists. So this was conducted at Henry Ford Hospital in a retrospective chart review between 2017 and 2022. It included adult patients that had bedside PEG tubes or fluoroscopic gastrostomy tubes in ICU patients. It used propensity score matching to compare the patient characteristics of the patients getting these procedures, their hospital course comorbidities, complications, and results. And we primarily looked at the major and minor outcomes, complications rather, of these procedures, which were described as requiring operative or procedural intervention or requiring bedside intervention for the minor complications. So looking at some of the patient characteristics, and I'll highlight the ones with statistical significance and the ones I thought most interesting, between PEG tubes and fluoroscopic tubes, the patient characteristics were largely the same in terms of they had multiple medical comorbidities. There were some slight differences between like hypertension, strokes, and dementia, but the two primary ones I highlighted were malnutrition and malignancy, which had the largest differences, where our PEG tube patients were primarily for the indication of malnutrition, whereas the fluoroscopic tubes were for malignancy. And then looking at other indications too, and I'll highlight the primary ones, more of our patients who had traumatic indications underwent PEG tubes, whereas the patients undergoing the IR fluoroscopic tubes were primarily of neurologic indications. And then there was also a slightly shorter length of stay in the patients undergoing fluoroscopic tubes compared to PEG tubes. And then looking at the data, primarily the disposition and the complication rates, where we saw the largest differences. In terms of patients who had these procedures done, there was fairly equal rates of death and going to hospice at 10%, which is significant, especially if we're going to do a procedure that has multiple complications where 1 in 10 end up pursuing hospice. There was a large difference in the all-cause complication rate between the two groups. Bedside PEG tubes had an all-cause complication of 13% compared to 25% for the patients who had fluoroscopic gastrostomy tube placements. And some of the complications are highlighted down below as well in terms of tube dysfunction with a larger percentage of IR tubes, and then tube dislodgement and surrounding organ injury were much higher with PEG tube placement. So to summarize the data in terms of the patient characteristics, overall the patients were similar in terms of their populations, their comorbidities. Patients undergoing PEG tubes had higher rates of malnutrition and dementia, whereas patients undergoing fluoroscopic tubes had higher rates of malignancy and stroke. And I'll just put everything on the board here. In terms of indications for our PEG tube patients, they were more likely to have traumatic indications, primarily respiratory or cardiac, and higher length of stay. Both groups had similar rates of ending up with hospice enrollment, rates of death and time from gastrostomy tube placement and readmission rates, whereas the complication rates for PEG tubes were 13% compared to 25%. There are lots of reasons why the data was different between our groups, and there's a lot of differences in how people place PEG tubes between providers and institutions and fluoroscopic tubes, whether or not T-fasteners are used, how the complications are tracked between groups, and potentially less sick patients getting certain procedures versus otherwise. Thank you.